Opioid addiction is a national public health crisis that affects individuals and families regardless of their age, race, or income. The statistics are overwhelming. More than 130 people die from opioid addiction every day. But there is hope. Recovery is possible. The information contained in these podcasts is solely for informational purposes and should not replace advice from a medical provider when making healthcare decisions. This podcast contains opinionated content and may not reflect the opinions of any organization this podcast is affiliated with. Nothing discussed in this podcast shall constitute or should be construed as endorsement by the Independence Blue Cross Foundation or Independence Blue Cross, LLC, of any product or service discussed herein. We will discuss opioid use and opioid treatment, which may be triggering for some listeners. Listener discretion is advised. If you or someone you know is suffering from opioid addiction, please visit ibxfoundation.org/SYK. The link is in our show notes below. In Season 4, we are joined by so many inspiring guests who are sharing their story of connectedness, the theme of this season. And today, on Someone You Know, we're joined by Dr. Latika Davis-Jones, the Secretary of the Department of Drug and Alcohol Programs for the Commonwealth of Pennsylvania. In this conversation, Dr. Davis-Jones discusses her career journey in both the public and private sectors, as well as how she is leading the charge in elevating the power of recovery in Pennsylvania, the resource implementations the state is making to showcase that recovery is possible and there is hope, the importance of connectedness within communities of all demographics, and the statewide engagement tour she is currently on. I'm your host, Heather Major, and this is Someone You Know. So Pennsylvania Department of Drug and Alcohol Programs has a mission statement. What do you want to say about that mission statement?
Our mission statement drives everything that we do each and every day here at the Department of Drug and Alcohol Programs. It's our why, right? And it's truly centered around this idea that we want people to recover. And so we keep that vision at the forefront of our work. And it's centered around this idea that we believe people can rise. And so every day we are working to reduce stigma. We're trying to improve our prevention efforts and thinking about it from the perspective of strengthening our treatment system and empowering sustained recovery. That is our why. That's what we do each and every day.
And it's a huge effort for the Commonwealth, a state that's primarily rural. There are 67 counties in our Commonwealth. It's a fantastic state, in my opinion.
Absolutely.
And there's so many great things about the Commonwealth, but of course, the rural nature and geography creates has its own set of challenges when it comes to the disease of addiction, the strength of the recovery and treatment systems, and the connectedness of people to the systems themselves, but to the broader community. What are your thoughts on how you address that? Because there are two major metropolitan areas in the Commonwealth, but then everything in between, I would say, is really reflects the rural nature of our state.
Yeah, absolutely. You're spot on. The Commonwealth, we know that certain areas are truly rural, and as you mentioned, there's Pittsburgh and Philadelphia, right? And with that, we know the importance of connecting with partners to truly deliver on what's needed across the Commonwealth. And our key partners are the single county authorities, local drug and alcohol offices that are truly the boots on the ground, understanding what's needed in their geographical locations. And so we work closely with them to ensure that there's equity in the delivery of services. So whether it be prevention, intervention, treatment, recovery supports, and harm reduction, we work with those partners to make sure that a continuum is available. However, we recognize the challenges that come with individuals living in rural settings, and so we're often trying to problem solve for that, right? How do we expand access? How do we innovate in a way that allows those that are living in rural settings to have access to the services that they need, and building upon what we know is already happening in urban are suburban areas, right? And so key initiatives like mobile treatment, telehealth, right? Also the capacity to think about how we integrate services. So people go to primary health care. They should be able to also get their behavioral health care there as well. So really thinking about how we can maximize opportunities to deliver care that's needed across the Commonwealth.
Yeah, no easy task, but I know that you're up for it. I know that your background has a lot to do with how you understand
Absolutely.
the systems and sectors and communities that are in the Commonwealth that we're a part of. Tell us a little bit about private sector and your private sector work.
Yeah.
There's a lot to talk about there.
Yeah.
That has certainly well prepared you, but you made a choice. You made a choice to leave the private sector to come into the public sector.
Yeah.
So I think that your commitment to drug and alcohol prevention and recovery, it spans your career, professional career. So curious, making that switch, and then we can talk a little bit about sort of taking the knowledge and learnings from the private sector and how do you make them fit within the constraints of the public sector?
Yeah, absolutely. I think that is a great question. Loaded, lots of pieces to it.
Take it
but
anywhere
I'm
you
going to
want to
try
go.
to dissect it a little bit, right?
Wherever you want to go with it.
When I think about my work has historically been inspired by the idea of being connected to community and having a strong sense of community, and this idea and desire to really connect individuals to resources and information to improve their overall quality of life. And so when I first started, and I'm smiling a little bit, like I had all these ideas of all the things that I was going to do, right? I knew I wanted to be a health educator. And so in undergrad, my focus was on health education. And right after undergrad, I had an opportunity to work back in the community in which I was raised. And it was an initiative that was focused on maternal health and improving maternal health outcomes for low-income women. And so the idea was truly centered on this piece of trying to reduce the number of low birth weight babies. And doing that work, I quickly began to understand the barriers that individuals had in accessing care, services, and supports. And from that experience, it truly led me to think about how do I get a seat at the table to inform some of the decisions that are being made around helping some of the most vulnerable individuals that I was engaging with at that time. And that sort of lit the fire in me around wanting to improve access, improve services, and also to ensure that diverse perspectives were being considered when thinking about the development of programs and initiatives that I was seeing happening at the time. So I would say this idea of giving back, being connected to the community, and the desire to make sure people have access to, for lack of a better word, like the right information, because navigating systems can be hard.
Oh, for sure. It's complex. Yeah. I'm so curious because you mentioned joining the current administration in 2022 as the Secretary of Drug and Alcohol Programs for the state of Pennsylvania. What did you come in thinking about as far as your vision, as far as what you thought were the opportunities, things you were most excited about?
I think one of the first things that I came in thinking about was this idea. I'm like, I already know the department. I know those folks, right? Because I worked as a single county authority administrator in Allegheny County. So I didn't feel like I was coming into a strange place. In fact, I had spent like 10 years of my life working extremely closely with this department. So there was a level of excitement because I felt like I had insider knowledge. I had some ideas of what I felt was working really well with the department and, let's say, the single county authorities, but also I knew that there were opportunities. And so I was excited about it. I was like, I know how SEAs feel about DDAP, and I can leverage that information to build connections.
Absolutely.
Right? To improve our relationship with key stakeholders. And so from day one, I came in thinking about that. Like, how do we improve what we have an opportunity to do each and every day, and understanding that our work as a department is not possible without our relationships with key stakeholders, such as the single county authorities. So it was an opportunity, and we are delivering on that particular concern that I had day one. And I will say, I firmly believe that our relationships have improved because of this idea of believing in the power of stakeholder engagement and giving people a voice and giving them the opportunity to share their perspective. It has truly helped us to think about how we improve services across the Commonwealth, and how we also think about our relationships with SEAs, with providers. You know, we hear time and time again, the administrative burdens, there's inefficiencies in the system. And so hearing them directly has provided us with an opportunity to do some things differently.
Yeah, can we talk about how you're going about hearing that feedback directly and that input and insight?
Absolutely.
Okay. Because you have done something that I think is tremendous for the role that you have. You've been out literally everywhere, and I don't know if everyone understands, but the distance between here, the sort of central part of the state, and sort of the corners of the state, and everywhere in between is hours of driving.
Yes.
It's far, but you
Yes.
have made it a priority, not just a point, but a priority
Absolutely.
to be out in the community, but not in a performative way. You've been out in the community in a purposeful way.
Absolutely.
And I would love to be able to talk a little bit more, because this is your connection. This is exactly what you're talking about.
Yes.
You trust and rely and empower your SEAs. Obviously, they're important partners in your work, but you understand the importance of your role and your responsibility, probably beyond just the commitment that you've made, but you understand it's a visible role, and you understand the need to have feedback
Yes.
to improve, for continuous improvement. You've got to be able to tweak some.
Confirm that something's working as well, you know.
And that's a beautiful thing too. So maybe we could talk about, where have you been? What have you been doing in those meetings?
Yes.
How have they gone? What are some of the, like, if you're thinking back, I don't know how long
Yeah.
you've been on, I don't think you've stopped.
Right. We haven't stopped.
You haven't stopped. So we're lucky. We caught you on a day where you're probably in between,
It's
where you're
recovery
going
month.
next. Yeah.
So we're focused on recovery month.
And-
But to, sort of talk about our stakeholder engagement tour. Since 2023, we have been going all across the Commonwealth. To date, we've visited just about 34 counties. We've sat down with more than 600 individuals at roundtable discussions.
People from the communities, people from those counties.
Absolutely. So we're talking about individuals with lived experience, family members, providers, key stakeholders that have the true ability to tell us exactly what they need. We've also had legislators at the table, and so it's been truly a blessing to hear directly from those stakeholders. We've visited providers, I think to date, just about 58 providers thus far, hearing their story, what's working, what's not, but also highlighting the wonderful work that's happening within their organizations. And so it's been an amazing experience. And we're hearing, things like, yes, we are excited about the fact that services are available. However, here's what we need more of. And so we've heard, when you think about women that are going into treatment programs, they've talked about barriers to treatment, such as transportation. And that's a key issue for rural settings as well. Childcare. And then even for a mom to have to decide on who she's going to take to treatment with her, because she can only take 1 or 2 children, and some people have 3 or 4, right? Some women have multiple children. And so this idea that we would develop and expand our residential treatment programs to allow women or a father, to bring multiple children into their treatment programs. Many moms struggle with that idea of I have to choose which ones to take with me. And then this idea about, we have diverse communities, and it's important that anyone going into a treatment program or trying to receive prevention services, intervention, that they have the supports that they need. And so one thing that we heard loud and clear too was the importance of making sure people had access to language supports, right? So interpreter services, making sure that if someone is engaged in treatment, for example, that if they can't have an interpreter, that we would use technology to assist them, because how can you fully engage in residential treatment if you don't have interpretation services, or if there isn't staff that is bilingual, right, to actually translate.
Right.
So we've heard things like that.
And communication is obviously a very important part of the work that you lead. And what we think we're trying to convey in our message may not be what is received in our message.
Absolutely.
That's tremendous, because you're right. I mean, I sense from you that it's both a connection opportunity and a learning opportunity. How fast or how well do you think you're able to act on some of the feedback that you receive through those meetings?
Yes, so my team would be the first to tell you that I'm always talking about like sort of the low-hanging fruit, like what can we change today? And there are like easy things, right? Things like how do we communicate about all of the wonderful things that are happening in the department? So we kept hearing time and time again that we needed to have more trainings, more diverse trainings, or updating our training curriculum. And the funny thing is when I took that information back to the team, they were like, no, we do a lot of training. In fact, we have a new series, we've done this, we've done that. However, the community at large did not know. Our stakeholders weren't informed. And so we are now working very closely with our comms department, advertising a lot of our trainings, making sure that people know what resources are available and how to go about registering for those trainings. You'll see it on my LinkedIn page. You'll see it on the DDAB LinkedIn page, our social media channels. We're working really hard in real time to take that information that's provided to us. And if it's an opportunity to have a quick win and to elevate what we heard, we're doing that in as real time as possible. So that excites me. I'm like, this is an easy one for us, right? It doesn't take reg reform. It doesn't take legislation, right? We can do this now. This is an easy fix. Another thing that we heard when we were out across the Commonwealth was this idea of how do we get information to individuals in a timely fashion, and understanding that people are moving beyond email, right? Everyone has access to their phone, but everybody's not now checking email,
sure,
right? And so we heard things about making a chat feature available on our website, or to also do text messaging for important alerts and training opportunities. And so we are just about almost there with being able to do just that. Like, we're not going to text them for everything, but things that we think are really important, like policy updates, training updates, or there may be a drug supply trend that's happening across the Commonwealth. We are going to have the opportunity to sort of text in as real time as possible. So I'm excited about that.
I'm excited about that too. I'm excited about that, and thanks for sharing that new development with us, because
Yeah.
that's going to be phenomenal. Giving people the information they need in the matter and means in which they can receive it.
Absolutely.
It's phenomenal. Any highlights from a storytelling or person perspective that you want to talk about from the tour so far? Has anyone come up to you and said, thanks for all you're doing, or love what you're doing, and here's how it impacted me or my family or my friend?
Yeah, absolutely.
'Cause I know a lot of it is like, here's what's going wrong and please fix all of it. But there's got to be some moments, hopefully, for you and for your team. There's got to be some moments where you say, this is our why. Remember our why.
Yeah, absolutely. And I can say we've been very strategic in our approach on this engagement tour. While we clearly wanted to hear what wasn't working, we also did pose a question around, tell us what's working. And so, again, the fact that across Pennsylvania as a whole, we do have really a generous benefit package. Like, we're trying to make sure that all services are available. But what I've heard, and I can think about a most recent tour stop, is the opportunity that I recently had to hear a story from an older gentleman. His name is Tim, older African American, and he now has 3 years of sobriety under his belt. And he talked about how he truly hit rock bottom, right? He talked about his wife dying in his arms, losing his job, losing his house, losing his will to live. And because of the fact that someone connected him to resources, he is now focused on rebuilding his life. He talked about how having access to peer support services, how those services have really helped him in a way that has been beneficial with working on his mental health, his substance use, and then also being able to give back. He said giving back what was given to him has been sort of like his lifesaver. And so hearing stories like that, someone that has had the opportunity to engage all aspects of our system, and now having 3 years of sobriety, that's an amazing story. That's success.
That's success.
Yeah, absolutely.
And you need that. I mean, I think we all need that. I think that's been a cornerstone of what we have been trying to talk about and convey through Someone You Know when it was first a campaign, and through the storytelling, and now in a podcast, is that recovery is possible. You said it in the beginning of this conversation. It's not just possible, that it can happen.
Yes.
And we have the right supports. I think one of the things that I'm hearing from you is a recognition and validation that Pennsylvania has made a commitment, and also has the support services and systems and resources to fulfill its commitment to people and families who are struggling with substance use disorder. Is that how you feel about the Commonwealth? Do you feel like you're improving upon something that was good and you're making it great?
Absolutely. We're building on the successes of this department and other Commonwealth agencies. We are understanding it from a perspective of we all have the opportunity to do better, right? And so taking that approach, I don't think we really get caught up on this idea if someone reports something not working, that it's a negative impact against the administration. I think we firmly believe that it's an opportunity, and that we should be listening from the perspective of, this is what we're hearing. Let's confirm what we're hearing. And if we know, in fact, what is occurring or what's being said is happening, how do we fix it? And so, again, lots of success, lots of opportunity. When I think about this department, the Department of Drug and Alcohol Programs, we are invested. A lot of work historically has been centered on treatment services and perhaps even prevention. But I can say what I'm most proud of is that we are truly elevating the power of recovery, and we're doing that in a meaningful way. We have invested in 9 recovery hubs across the Commonwealth, and those recovery hubs are focused on connecting people to key resources and being focused and intentional about what those 9 hubs, those geographical locations that they cover, what is needed and how do they bring people together so they're perhaps not duplicating services, and that each arm of that recovery hub is informed and working together to improve what's happening in their regions. So I'm really excited
That is
about
exciting.
that as well.
That's an exciting development for everyone in the Commonwealth, and the coordination of the services and systems that are here, that are available, that are working is so key. But
Yes.
the focus that you're talking about on recovery, I think, is an important one. We've spent the past several years establishing and growing the number of collegiate recovery programs in southeastern Pennsylvania, which we're incredibly proud of.
Yes.
Taking Pennsylvania from, as a nationally, from the bottom of the list and bringing them to the top of the
ranking,
list.
yeah.
And that was never the goal per se. That's the result. But what that has done is that has brought institutions of higher education into the recovery space in ways that they weren't engaging in before. And like yourself, right, there needs to be a catalyst for that type of change. And it is amazing to hear that you're not just respecting the full continuum of what substance use disorders are and what people need, but that you are emphasizing recovery. And recovery is a lifelong commitment.
It's a journey.
It's a journey, and it's not linear. We all know, right? It can be a zigzag. It can be, a meandering path. But for people that achieve it, I've heard similar stories have been shared with us about the joy of giving back, the joy of appreciating the life that we have on this earth and wanting to fill it, just overflow, your heart and your world with the good. I'd love to know more about recovery. I know it's a really pivotal part of your focus as the secretary, and certainly you understand it better than most, that it is the next and longest sort of maintenance phase of someone's journey when they get there.
Absolutely.
What's on the horizon for recovery in your mind?
Yeah, so what's on the horizon? So a couple of things. You touched on collegiate recovery, right? We are definitely interested in expanding that work, but not just at the collegiate level, but also thinking about recovery high schools. We only have one
Bridgeway.
here, right? We only have one. And so my policy director, along with her assistant, they're currently working on, gathering some information, working with the Department of Education to see how we might have the capacity to build that out. And so I am excited about that. And we've had an opportunity to also visit Penn State University. Penn State, it was eye-opening. I was so proud of the work that they were doing at their main campus. They've created a safe space, a safe environment for students to thrive on campus. So everything from housing to places where they could hang out, coffee, a true community. And so it was powerful to see that work happening on campus.
But I will say that our experience has taught us that these are commitments made from the top of the administration at these schools, led by faculty members and co-led by students. So the buy-in and the participation and the involvement is real.
Yes.
And then when it comes time for students to graduate, which we actually have a study that demonstrates that students who are in recovery, who are able to go to a 2 or 4 year program and have these types of supports on campus, they graduate on time. And so what we've learned is that these students, if the right supports are in place, no different than any other type of setting, they're able to succeed and excel. and but they also leave their own legacy, and there's always a student or a faculty member who is like ready and willing and able, stepping into whatever that role was. And so that I don't want to call it sustainability, but I think the longevity of these programs, even just after a few short years of us funding them, is there.
Yeah, it's institutionalized.
It really is.
And I can honestly say we saw the passion in the faculty there. The faculty member, at least at Penn State, and the student, you could tell that was a solid relationship and investment. So again,
genuine, earnest,
yes,
wanting the student's success.
Yes.
I mean, that's what they're there for. And
absolutely,
so I love hearing this from you.
Yes.
Collegiate recovery programs obviously have a special place in the work that we do, and we've learned a lot from that experience. But it was also an opportunity for us as a funder to really put Pennsylvania on the map in a different way as a leader, especially in the substance use disorder space, and to make a commitment as a foundation to something that is meaningful and purposeful in our region. So we have so many institutions of higher education in southeastern Pennsylvania.
Yes.
We'd love to see more
Absolutely.
in our region, and we'd love to see obviously more across the Commonwealth. So I offer you our help in any way that you need
Absolutely.
on this collegiate recovery opportunity. Is there anything else you want to talk about in terms of the things you're most proud of, the changes that you've made thus far?
The fact that we are elevating recovery at the state level is huge, and we're doing it in a large scale. So we have three key events that are happening this month. Recovery Out Loud, our kickoff event at City Island, then Recovery in Nature, that's really focused on getting people outdoors and using nature as a way to heal. And then we're concluding with our event at the Capitol Complex at Soldiers Grove, and that's going to be focused on wellness, a wellness and resource fair, and bringing people from across the Commonwealth, including providers, to Harrisburg, to the Capitol, to really promote recovery. But the other thing that I'm proud of is the fact that we're really focused on this piece around stigma. You brought up stigma at the beginning of our conversation, and I will say that what I recognize is that stigma is real, it's alive, it's well, and that while social stigma may be live and well, so is self-stigma. And that self-stigma, like shame and guilt, keeps people sick, keeps people ill, and keeps both social stigma and self-stigma actually can keep individuals from accessing the care that they need. I'm excited about our Life Unites Us campaign and the work that's happening there. Through that campaign, we've been able to reach over 2 million individuals to date across the Commonwealth, and we're now in our 4th year. And so we're learning that the population that's engaging with the campaign, and the campaign uses stories of those that are in recovery to share, that recovery is possible, and they're sharing their experiences. And so perceptions are changing, right? From those that have viewed the campaign to those that have not. We know that people are now more accepting of fentanyl test strips and harm reduction. We also know that people are more likely to access naloxone and not look at it as a bad thing, and to get access to naloxone for family members and friends, right? And so I'm really excited about that campaign because people are now becoming educated. They're aware. And we know that for individuals that have viewed the campaign, they truly do believe that individuals with an opioid use disorder, that they can recover, and with the right treatment, that individuals are likely to go on to live productive lives. And so I'm really excited about that work, and that we're going to continue to reduce stigma across the Commonwealth.
I think that's phenomenal. We'll help any way we can. I think, credit to you and to your team for understanding the way to address stigma in terms of how you communicate about it and how you message about it. I think one of the things that we hear a lot about campaigns is where you only reach the people who already know what you're telling them. So it's even more encouraging to hear that your sense is that you're reaching beyond that with your campaign.
Absolutely. I mean, the research that's going behind our Life Unites Us campaign is rigorous. And so they're surveying those that have watched the campaign and that have interacted in all the different forms versus those that have not. And they're seeing a significant difference.
I want to thank you again for being here, Secretary, and for allowing us this time with you. You are obviously a phenomenal leader in the Commonwealth, and we're all humble and grateful for all that you're doing to ensure that all of us in the Commonwealth have access to services, treatment, prevention, intervention, and certainly what you're doing in recovery is phenomenal. So I just want to take the opportunity to thank you again for your time and for being a willing guest on our podcast. You really are a tremendous leader, and we're really fortunate to have you as the Secretary of Pennsylvania Department of Drug and Alcohol Programs.
Thank you for having me. It's been a pleasure.
If you or someone you know is suffering from opioid addiction, please visit ibxfoundation.org/SYK. The link is in our show notes below.